Doctor, good to see you again. And for those who don't realize, you're not walking in the park, you're on your treadmill like you normally are, getting in your exercise, and it's just really good to see you.
Exercise is critically important for health, and you are a great role model of that.
You know, I am, I talk about your book, How Not to Die, so often, and I also talk about your book, How Not to Diet, and just on my cell phone, I have a link of some of your videos when people deal with everything from diabetes to heart disease to strokes. And I really encourage people to really take their time and look at some of the small vignettes and videos that you put out. But it really has been a benefit for so many people. They tell me all the time how much they benefit. Just an easy way to communicate and talk to people and not at people.
Well, that's why I do what I do, and I appreciate you helping me help everybody.
So tell me about your new book, an exciting new book that you're doing. Share with this venture and what are the benefits of this new book?
Yeah, new book, How to Survive a Pandemic. People don't realize that, the first half of my professional life, I was a public health director working on emerging infectious diseases, wrote a book, wrote a lot of papers about it, but shouting from the rooftops about the risk of the coming pandemic, no one seemed interested. So I moved to what was killing Americans year after year, heart disease, the #1 killer every year from 1919 to 2019. But always keeping in the back of my mind that the reason why in 1918 the #1 killer wasn't heart disease was because it was pandemic flu. And I'm afraid this year heart disease is going to get knocked down again. And so this gave me an opportunity to delve into my past and bring all that expertise. And so basically I cover everything that there is to know how to protect ourselves and our families from the coronavirus, from respiratory and hand hygiene, surface disinfection, masks, how to make your own, budget hand sanitizer, etc. But the best way to survive a pandemic is really to prevent it in the first place. And so that's the bulk of the book, actually centers around tracing the origins of the COVID coronavirus and what we can do to prevent even greater infectious disease threats in the future.
Tell me something. Let's step back for one moment. What is a pandemic?
A pandemic. A pandemic is a global outbreak of disease. We may have heard of epidemic. That is more of a localized outbreak of disease. But the terms pan means all, and the term demos, the root, means the people. And so it's a disease of all the people. And there are 3 criteria for a pandemic pathogen, 3 ways in which a new pathogen can infect people around the world. One, it's the fact that it's a new pathogen, so we have no prior existing immunity. We've never experienced it before, and so everybody is susceptible. No one has immunity. Number 2, a respiratory pathogen, a breathed pathogen from one to another. And the 3rd critical criteria is the fact that we can be infected and infectious, contagious, before we even start showing symptoms. So 48 hours before you start coughing and the fever, you look perfectly fine, you feel perfectly fine, but maybe exhaling virus with every breath. That's why it's critical to use masks and face coverings out in the public as a sign of respect. It's not that you're protected, you're protecting others from virus that you may be spreading around. That's why the social distancing is so critical to slow the spread of this infectious disease.
That's interesting. So now, if people around you are wearing a mask, are they also protecting themselves as well as protecting and respecting you?
They're protecting you. It's a selfless act. It is an act. You are protecting your community. None of us knows whether we're infected or not until we start showing symptoms because we have inadequate testing. If we had enough testing, then we could know. But since we don't know who's infected, who's not, We need to try to keep everybody away from everybody else. And wearing a mask can cut down on these little tiny respiratory droplets that we inadvertently spit out when we talk, when we breathe. But they settle to the ground rapidly. So that's why if we stay about 6 feet away from one another, those droplets shouldn't get from one person to another. By covering our nose and mouth, will decrease the number of those little droplets that we inadvertently spit out into the environment, and thereby preventing infection to others. But it really doesn't protect ourselves. I mean, there are specific masks, these so-called N95 respirators, that our medical heroes are wearing. That is for personal protection. That is to protect themselves. But these cloth face mask coverings are really to protect others. And so that's why going out with a mask is a sign that you care about your neighbors, you care about your community.
Wow, and that's so important. That's important information. So when we see large communities wearing masks, it really it's a level of respect for our neighbors, and how do we feel about each other, you know?
Absolutely, absolutely. And so that's why, even if you're a young person without these pre-existing conditions that can increase your risk for this disease, you may not feel that you're at risk, but you may be exposing other people who either themselves are at risk or come in contact with someone who is at risk. So, going out to a bar, two young people talking to one another, and they think they're at low risk, but yeah, one may then go back to see a grandparent, and lead to a come together to protect one another. And hopefully that'll be the silver lining of this pandemic, realizing we are all in this together, and as well as highlighting some of the problems in terms of lack of adequate health insurance, in terms of racial inequalities for healthcare outcomes. Hopefully this will really help us look forward to a future in which we're all in this together, not only as a nation, but as a world.
So true, so true. Now talk about those 48 hours. You said within the 48 hours, you may not show symptoms or signs. Can you expose people within that 48 hours?
Unfortunately, you can. The average so-called incubation period, the time between when you come in contact and become infected with the virus and the time you start actually showing symptoms, so you know you have it, is 5 days long on average. Now, it can be as long as 14 days, which is why the quarantine criteria are for 14 days, but typically it takes about 5 days. But it takes a few days for the levels of virus in your throat to rise to a level where you start spreading it to other people. But in that 1 to 2 days before you start showing symptoms. So again, you don't think you have it. You feel perfectly fine. You're still going to work. You're still interacting with others. For that critical period before you start showing symptoms, you can be, just with every breath, you can be exhaling virus. On a really cold winter day, you know how when you breathe, you get that flume of kind of smoke coming out of your mouth? Those are little tiny droplets of water straight from your lungs condensing in the cold air. Well, in the summertime, you're still blowing out all those little droplets from your lungs. You just can't see them because it's not cold outside. But you can imagine, on a cold winter day, this plume of smoke coming out of your mouth, if you're talking to someone a few feet away, would reach them. And those little droplets can contain virus before you even know you're infected. But you can imagine on a cold winter day, if you had a scarf over your face, a lot less of that steam would be coming out of your mouth and less likely to reach the person you're talking to.
A very, very good example. And actually, I haven't heard anyone put it that way. And before I get into the meat of the subject, excuse the pun, tell me for a moment the information that's being put out, and even better yet, is this a perfect science? Because I'm getting a few strange cases. A friend of mine, her son had all the symptoms, and then when she got tested for about 2 weeks, She had no symptoms at all. She was told 2 weeks prior that she was positive, but she had no symptoms. Why are some people showing severe symptoms and others are walking around and they're sort of this new term we've learned, asymptomatic?
It's remarkable. Some people that get infected don't show any symptoms at all. They have no idea that they're even infected, and you think, well, that's great. Oh, wouldn't it be great to get the disease but not have any symptoms at all? I mean, for that individual, it's great, but the problem is that person may still be spreading the disease. That's why it's so hard to stop this disease, because you can't just look at someone. If you saw someone hacking, coughing on a subway car, you could move to the other subway car. But if the people look totally fine, then you don't know who's infected, who's not infected. And that's why it's really insidious. It's really sneaky how this virus is getting around. But some people are at severe risk of serious disease and even potentially death. And these are the people we need to protect in our society. These are people who have underlying predisposing conditions. And that we're talking is high blood pressure, heart disease, obesity, and type 2 diabetes, right? All of which can be controlled or even potentially reversed with a healthy enough diet and lifestyle. So this is the time to take care of yourself. If you've been putting off starting an exercise program, cleaning up your diet, this is the time, because it's not just going to protect you from chronic diseases far down the road, years down the road. It's going to protect you in the here and now, day to day, protect you against getting this disease and suffering a severe course from this disease. Even having a BMI, a body mass index of 28, which is like being 175 pounds at the average height, American height of 5'6", even that puts you at significantly higher risk, about nearly 6 times the risk of suffering a really severe course. And the average BMI in the United States is 29. So even being skinnier, the average person in the United States is so overweight that even being skinnier than the average person, you could still have so much excess body fat that you are at risk for a serious infection. But as we know, there's nothing predestined about being obese. We can have control over our diets. We have control over our lifestyles. And this is the time, if there was ever a time, to start eating healthy.
So important. Let's go in an area where we're not hearing much about. Everyone is really talking about access to healthcare. Everyone is talking about what to do when you get the virus or any chronic disease. And I want to sort of switch gears and talk about really prevention. And I want to start with a conversation that no one is really embarking upon. And that's how does factory farms fit into this equation?
Yeah, no, that's a very important question. And, I think for some it's too early to be talking about pandemic prevention. Look, we have a pandemic right now. Let's deal with this one before we deal with the next one. But at the same time, this is the perfect time. It's like when there's a school shooting. People are like, no, it's not the time to be talking about, legislation.
Right.
But no, it's the perfect time to be talking, because all eyes are focused on the tragedy. And so I'm so glad you brought that up. Over the last few decades, new human diseases have emerged at a rate unprecedented in human history. And you say, wait a second, emerged from where? Where do diseases emerge from? Mostly from animals. So, for example, the AIDS virus is blamed on the butchering of primates in the bushmeat trade in Africa. Mad cow disease was because we turned cows into carnivores and cannibals. SARS and COVID-19 have been traced back to the exotic animal trade in Asia. But our last pandemic, the 2009 swine flu, arose not from some backwater wet market in China, but was largely made in the USA on pig operations in the United States. Now, thankfully, Swine flu only killed about 500,000 people, but the next time we might not be so lucky.
Wow, wow, wow. So what are some of the things that we could do to start curbing the, the factory farm aspect of this? What could we do on the ground?
Well, when we overcrowd thousands of animals into these cramped, filthy football field-sized sheds to like beak to beak or snout to snout atop their own waste, it's just a breeding ground for disease. There's the sheer numbers of animals, the overcrowding, the stress crippling their immune systems, the ammonia from the decomposing waste burning their lungs, lack of fresh air, lack of sunlight. Put all these factors together, well, you really have a perfect storm environment for the emergence of these serious diseases. That's why the American Public Health Association, the largest and oldest association of public health professionals in the world, has called for a moratorium on these so-called factory farms. No more factory farms. That's what the public health community has been calling for, and it's really up to us. We can vote 3 times a day with our fork as to what kind of food we bring into our homes. And from a policy level, we need to regulate these farms. The animals could use a little breathing room. They could use a little social distancing themselves. There's a number of reforms that can be done to make these operations less risky. But even better in terms of thinking long-term is really shifting our diet away from animal agriculture and using, plant-based sources of protein, which are healthier both for our own health, both from a global health perspective, from a climate perspective, in terms of our environmental footprint, our greenhouse gas footprint, and now the world is waking up to the global health perspective in terms of pandemic risk. And so, there's a lot of these, plant-based meat substitutes out now in everywhere from Dunkin' Donuts and Burger King. From a personal health standpoint, they're not the healthiest, but from a pandemic threat standpoint, they're zero risk. Now, obviously, I'd love to see people eat more fruits and vegetables, healthier sources of protein like beans and split peas, chickpeas, lentils. But if we're just talking about the infectious disease risk, the pandemic risk, these products are all superior in terms, they're better for human health. They're not the best for human health, but in terms of preventing the next pandemic, this is where we need to move to. We need to accelerate the progress towards plant-based meats, plant-based dairy products, plant-based egg products, shifting our food system over for the benefit of future generations.
Wow. So help me understand. If the more plant-based, if we are all on plant-based, do we mean no pandemics?
Oh, I mean, if we have evidence showing how critical that breaking that link is. So, for example, the reason why European plagues wiped out the Native Americans and not the other way around. Why didn't Native American plagues wipe out Europeans? Because there were no plagues in the Americas. There were no major infectious diseases. Why? Because there were no animals to domesticate. American camels were wiped out in the last ice age, so there's no smallpox, which came from the domestication of camels. We had buffalo, but we didn't have domesticated buffalo, and that's where measles came from. So there was no measles in America. So 90% of the people in this hemisphere were wiped out by the diseases brought out by the Europeans. Why? Because the Europeans had domesticated water buffalo, so they had leprosy. They domesticated chickens, so they had typhoid fever. They domesticated waterfowl like ducks, so we had influenza. These major infectious diseases all come from animals, but we can sever that link between people and animals and stop these viruses jumping from the livestock reservoir in the case of influenza and the bat reservoir in terms of coronavirus. People aren't getting coronavirus from bats directly. There's an intermediate host. There's an intermediate animal. So it was this cat-like creature called the civet for SARS, another deadly coronavirus. It went from bats to civets to people. There was a disease called MERS, which jumped from bats to camels to people. And now we have COVID-19, which we think jumped from bats to these scaly anteaters called pangolins to people. But we can break that link. We could sever that link by eating healthier foods that come from bushes rather than bushmeat.
Mm-hmm. So now, what about our immune system? How do we become a terrible host for viruses and diseases?
Well, we're talking about common sense measures. Nothing special. There's no magic pill, no magic supplement. It's getting sufficient sleep, keeping active, reducing stress, staying connected, albeit remotely, with friends and family, eating a healthy diet. These are the critical pillars of good health, both now and always, but particularly now that we have a nasty virus out there.
And when you can't say immune system without us automatically thinking about vitamin C. Is this something we should be taking, and should we be taking in supplements? And is that the real source of vitamin C as building your immune system? Is that the truth?
The best source of vitamin C is found in whole plant foods. That means citrus fruits, that means bell peppers, that means broccoli, that means tropical fruits. These are the kind of foods that have not only vitamin C, but the thousands of other important compounds. Rather than isolate out one constituent, it's better to eat, to get our nutrients from whole food sources. And so you want vitamin C? Go out and get an orange. Go out and get a tangerine. Eat some broccoli, eat some bell peppers, dip some into hummus. This is the way, the best way to get our nutrients, including these immune boosting nutrients like vitamin C.
And that's important, of eating the whole food and not just trying to isolate the supplement itself, and that leads me to, what else is out there? Misinformation. What are some of the biggest misinformation about this pandemic?
Oh, there's so much out there. I mean, it's hard enough to be fighting against this virus, but there seems to be a whole kind of infodemic as well of misinformation, and some of which that's really damaging. So, for example, in Iran, there were 1,000 cases of methanol poisoning, which is wood alcohol poisoning, because there was some kind of rumor that somehow drinking this deadly form of alcohol would somehow protect you. 1,000 cases of poisoning. Back in 1918, the pandemic that was a century ago, there was some rumor that high doses of aspirin were going to help people. They gave such high doses of aspirin, they shut people's kidneys down. Every time there's some kind of epidemic, the snake oil people come out, and there's all these rumors. People are scared. They're desperate for information, and so they'll grasp at everything. And unfortunately, it's leading to poison control center calls going up, and that's why we really need to stick to the best, most reliable sources of information. This is not the time to move to the fringes or the margins, because we're talking life and death. And that's why, people on the internet saying that the earth is flat, it's not going to hurt anybody, right? But telling people not to get vaccinated, I mean, that's the kind of thing that could really hurt people, and in fact, entire societies. And so that's why I encourage people. The CDC has done a wonderful job of putting together information and all these beautiful, simple graphics on their website. Another good source of information is CIDRAP, the Center for Infectious Disease Research and Policy at the University of Minnesota. They have a podcast every Wednesday, every week. Really the best source of information for kind of the lay public on what's going on, how serious the situation is, what's the latest science. So we really need to stick to the best sources of information. And there's great work being done, but unfortunately it's just getting kind of diluted and washed out by some of the crazy theories out there.
Tell me, on a bad situation, any good is going to come out of this entire incident?
I think there is. I mean, I think certainly this has laid bare some of the vulnerabilities of the political system, of the social system, of the medical system. I mean, the fact that, there's been this big debate in this country as to whether or not to tie employment to healthcare, for example, having employment-based healthcare. Well, here we are. We just realized now, with millions of people out of work, all of a sudden they lose their job. All of a sudden they lose their healthcare. I mean, no other country does it like that, and there's a reason they don't do it like that. And so, I mean, this is really kind of exposing some American exceptionalism, but unfortunately in a bad way. We're actually suffering more deaths per capita than anywhere around the world. More of our population is unemployed. Hopefully this will help us better prepare in the future. If you look at the countries that did the best in this pandemic, like Singapore and Taiwan and South Korea, why did they do so good? Because they suffered similar outbreaks recently. They all had SARS outbreaks, another coronavirus. There was a big MERS outbreak in South Korea in 2015. So they were ready. They had everything in place, the public health infrastructure in place to deal with it. And so if dozens of deaths or hundreds of deaths in these countries rally the entire country towards pandemic preparedness, well, then maybe the potentially millions of deaths from COVID-19 will rally the countries around the entire world, not just to be prepared for the next pandemic, but try to prevent it in the first place. And that means changing the food system.
I want to conclude with just one question, Doctor. Are you planning on getting back to lifestyle medicine, switching from what you're doing around pandemic?
Well, we're realizing now lifestyle medicine is pandemic medicine. When I was talking about, when we both were talking about the ravages of type 2 diabetes, leading cause of adult onset blindness and lower limb amputations and kidney failure, we weren't even thinking, this would also dramatically increase the risk if there was some deadly infectious disease out there. But here it is again. So taking care of yourself is helpful for all the various dimensions of health. So it really all comes down to lifestyle diseases. So I will continue to take on whatever's killing Americans, the top leading causes of death, and whichever way I can take it on, I will continue down that path, and honored to have you in the fight on the front lines.
Thank you. As a police officer, it was important to me to have a good partner when I was on patrol. It's great having you as a good partner as we on a patrol for good health. So I really call on the listeners and the viewers. Great book, How to Survive a Pandemic. Also, other great books by you, Dr. Michael Greger, How Not to Die, How Not to Diet. It's just some great reading. If you want to turn your life around, there's no better way to do it than to pick up your book and your other ways of communication, nutritionalfacts.org. Thank you so much. A real pleasure seeing you and interviewing you. And I'm going to get on my bike now.
Fantastic. Keep up the work.
Thank you. Take care.